Hi, I'm Rebecca, and I'm an exercise specialist with Pulmonary Rehab. For our education today, we're going to talk about exercise, specifically how to exercise safely at home. Now, I know you are already enrolled in an exercise program, but we have found that people have the most success when they are consistent with attending their pulmonary rehab classes and exercising a little bit at home. Now, there are many health reasons and benefits to exercise, especially if you have lung disease. So exercise helps to circulate your blood throughout your body, which sends oxygen to your organs. This also improves how well your body utilizes that oxygen and strengthens your respiratory muscles, making it easier to breathe. This is important because people with COPD and other lung diseases use more energy to breathe than those without lung disease. Other benefits of exercise include reducing shortness of breath by improving your tolerance to exertional activities. So in other words, you can do more activity without getting as short of breath as quickly. Exercise also improves your quality of life by giving you more energy, strength, and endurance to do the activities that you enjoy. Exercise can help reduce high blood pressure by dilating your blood vessels. This effect is seen for up to 22 hours after your exercise session, and it's more pronounced in individuals that have a higher resting blood pressure. So in other words, if you have high blood pressure, when you exercise, your blood pressure can go down, and that effect can last almost a full day. Exercise can also improve your balance and reduce your risk of falls by improving your reaction time and strengthening the muscles of your core, hips, and legs. So the stronger those muscles are and the quicker your reaction time is, the less likely you are to have a fall. Exercise also reduces stress and anxiety by reducing the hormones and other chemicals that build up in your body during periods of high stress. So this results in overall relaxation and reduced tension. Exercise can help reduce depression and improve your mood. So you may have heard that exercise releases endorphins. These endorphins interact with pain receptors in your body that help block pain, control emotions, and reduce fatigue. Exercise has also been known to improve your sleep quality. So you fall asleep more quickly, you sleep more soundly, and you feel more refreshed when you wake up. And then lastly, exercise can improve your mental sharpness. So your memory is improved, your concentration, again, your reaction time. So now that we have talked about why exercise is important, let's talk about how much and what type of exercise one should aim for. So it's always important that you begin each exercise session with a warm-up. So this should last about 5 to 10 minutes before any exercise session. And the purpose of the warm-up is to help loosen your muscles and joints. So this helps reduce your risk of injury. So 5 to 10 minute warm-up, again, to kind of loosen your muscles and your joints for your exercise. Now, cardiovascular exercise, some people refer to this as cardio or aerobic exercise. This should be performed for 30 minutes or more, 3 to 5 days per week. Now, that sounds like a lot. You don't have to begin all at one time. Maybe start with 10 or 15 minutes at a time and add a few minutes each session as tolerated until you reach the 30 or more minutes. Now, examples of cardio include walking, bicycling, dancing, swimming. Some of the equipment that you use here during rehab, like the bicycle, the new step, the arm cycle, those are all considered cardio exercise. So in other words, they're getting your heart rate elevated, you're breathing a little bit heavier. Those types of activities should be performed 3 to 5 days per week for 30 or more minutes. Again, you can start with smaller bouts and kind of add as tolerated. Now, our resistance exercises should be performed 2 days per week on non-consecutive days. So you do not want to do your resistance training on back-to-back days. So allowing alternating days gives your muscles time to rest and recover. Now, it's important that you include both upper and lower body exercise for your resistance training. So these can be performed by using your own body weight, using dumbbells or the handheld weights, or the resistance bands like we provided you in class. So what we would recommend is, one day do your upper body, the next day maybe focus on your lower body, and then alternate like that. Try not to do your upper body on Monday and Tuesday. Balance exercises should also be performed at least 2 days per week, non-consecutive days, especially if you're wanting to improve your balance. So that's something that we hear a lot of patients say when they start our program, is that their balance is not what it used to be. So the more that you practice these balance exercises, the more it will improve. So again, practice these twice a week on non-consecutive days. And then lastly, make sure that your exercise plan includes stretching or flexibility exercises. I personally like to do the stretching after the warm-up, or you can wait until after your whole exercise session is complete and then do it at the very end. Either way, you never want to stretch when your muscles are cold. So always at least warm up or complete your exercise session before stretching. You can hold each pose for about 10 to 20 seconds depending on, how long you want to stretch for. So this may sound like a lot to process, to think about how much exercise you need each week, how are you going to fit it all in. That's kind of what we'll talk about next, how to create a well-rounded exercise plan at home. So things that you should consider, the first step is defining your goals. So kind of identify what it is you want to accomplish from your exercise program and write it down. You are more successful, more likely to adhere to a goal if you have it written down. Now remember to make your goal a SMART goal. So make sure that your goal is specific, that you're able to measure it. Make sure that it's achievable, realistic, and have a time frame that you would like to set your goal. Now, some examples of goals may be a long-term goal, and some may be a short-term goal. So a long-term goal is something that, like the name would suggest, takes a long time to accomplish. So we're talking like 6 months or more. A short-term goal is something that can be accomplished a little quicker, so less than 6 months. I like to think of short-term goals as stepping stones to those long-term goals. So if we are thinking of examples, a long-term goal may be to walk around the track for 1 mile. For some people, that could take a longer amount of time to accomplish. So a short-term goal could be, I'm going to walk 4 laps without stopping. Once you've accomplished that first goal, then your next goal could maybe be 6 laps and kind of gradually increasing from there. But remember to write down your goals. You're more likely to stick with it, and it allows you to go back periodically to assess your progress towards that goal. After you've figured out what it is you want to work on, you kind of need to know where to start. So assessing your overall fitness level. Now we kind of do that for you here in the rehab program. We have everyone perform a 6-minute walk test where you walk around the track for 6 minutes. We see how far you can walk, and from there we help decide what levels to start you off on the equipment. So an individual that maybe only walks 3 laps during their 6-minute will start off at a lower level versus someone that walked maybe 7 laps during 6 minutes. So it's important to know kind of where to start. That way you're not starting with too much. You want to start off light and slow. And then reevaluate your progress regularly. So every month, every couple of months, just to track your progress, see how you're improving. Now, with that being said, you want to make sure that you start off slowly. Try not to do too much, too fast, too soon. So make gradual increases to your exercises versus trying to, increase too quickly. We use what's called like a 10% rule. So, for example, if you are, walking around the track for 6 laps, and that's feeling comfortable, the next time you don't want to double it and go up to 12 laps. Maybe go from 6 to 7. See how comfortable you feel with 7 laps and then add 1 more. Or if you're on the bicycle, maybe for 10 minutes. Don't add 5 the next session. Slowly increase your time so that you're not doing too much. So go from maybe 10 minutes to 11. Get your body comfortable with that, then go to 12 and kind of progressing from there. So this goes hand in hand with listening to your body and not overtraining. So adjust your exercise if you're feeling sick or having a bad breathing day. Pace yourself, stop to rest as needed. This is going to help you prevent an injury and prevent from completely wearing yourself out. So if it is a bad breathing day, maybe you need to, skip exercise for that session. Now, I understand with individuals that have lung disease, sometimes you have shortness of breath every day. So don't use that as an excuse to never exercise. Instead, maybe think about what your normal is, and if your breathing is worse than normal, then maybe skip the exercise. Or maybe you just did too much the day before. You need to allow yourself a little more time to rest. Maybe do your exercise a little bit later in the day. But either way, just make sure you're listening to your body and adjust your exercise as needed. Make sure you focus on safety at all times. Use proper techniques, good body mechanics, again, to help reduce your risk of injury. If something hurts, don't do it. In class, we teach you how to modify different exercises. For example, if we're doing our upper body resistance band exercises, and you know that every time you lift your arm above your head, it hurts your shoulder, maybe think about the modifications that we tell you. So maybe push out in front instead of up overhead. So again, if something hurts, don't do it. Make sure that you take all of your medications as normal and use oxygen if required. So if you wear oxygen while you are here exercising in class, make sure you wear the same amount of exercise or oxygen when you exercise at home. Avoid exercising in extreme temperatures. So if it's really cold outside or really hot and humid, you may not want to exercise outside. So kind of think about the time of day that you'll be exercising and where you choose to exercise, just to make sure that it's safe for you. Avoid poorly lit areas. Again, you don't want to go for a walk outside and it's starting to get dark and then you didn't see the crack in the pavement and you've tripped and now fallen. So make sure that your area is well lit, that you feel safe to exercise where it is that you're going. And then lastly, make sure that you are practicing good breathing techniques when you exercise at home. Now, we teach you this in class. Our technique is called pursed lip breathing. It's where we breathe in through our nose and out through our pursed lips. So I've provided a little diagram to help you remember. So as you can see, the gentleman is inhaling for a count of 2 and exhaling for a count of 4. Now, you don't have to count necessarily, when you exercise. Just try and make sure that you're keeping your breathing slow and controlled, we want to prevent you from hyperventilating. So just take your time, nice inhale and nice exhale as you're exercising. So it's natural for your breathing to get heavier when you're exerting yourself. We expect that. But practicing this pursed-lip breathing technique can really help slow down your pace of breathing and hopefully help prevent you from feeling, very short of breath. Remember, you want to maintain your oxygen levels greater than 90%. So if you have a pulse oximeter that you can use at home, I encourage you to keep that nearby. That way, every so often, you can check your oxygen levels to make sure that they remain above 90. And again, if you wear oxygen when you exercise with us, make sure you're wearing oxygen when you exercise at home. And once you have developed a good exercise routine, we want to make sure that you're eating sensibly, staying well hydrated in order for you to get the most benefit out of your exercise program. So, if you spend 3 days a week exercising in rehab and then you're adding 2 days of exercise at home, but you're wondering why you're not losing any weight, or, maybe you don't feel like your energy's improving, and it should be. Maybe that has to do with part of your diet. So we do have a dietitian on staff with us. Hopefully you've had the chance to meet with her. But if not, please let us know, because she is extremely smart. She knows how to, work with individuals that have lung disease, heart disease, diabetes. Maybe you need to gain weight. Maybe you need to lose weight. Whatever it is that your goal is, she can help you make sure that you're eating the proper foods to help you reach all of your goals. Staying well hydrated, that's a big one that people often overlook. Especially in the summer, we are sweating more, we're more likely to drink. But in the winter, it's not really on our mind. So, just make sure that you are monitoring how much you drink. And a good rule of thumb for how much liquid you need per day is to take your weight in pounds, divide it in half, and that would be the number of fluid ounces that you need per day. For example, if I weigh 140 pounds, divide it in half, that would be 70 ounces of fluids. Now, that doesn't have to all be from water, but the majority of it should be from water. So I personally like to have my coffee in the morning. Occasionally, I'll drink a cup of tea, or a small soda in the afternoon. But the rest of my, fluid for the day comes from water. So, make sure that you're staying well hydrated, eating the proper types of food that's going to help you reach your goals. So, the right amount of protein, carbohydrates, healthy fats, not stopping at Bojangles or McDonald's on your way home, and then wondering why you're not seeing any improvements. If your doctor has ever placed you on a fluid restriction, listen to their recommendation instead. So some people have heart disease or maybe kidney disease that may limit how much fluid they can have. So if your doctor has ever told you that, listen to them first. If not, this formula is a good, kind of estimate of how much you need per day. So now that you've developed an exercise plan, you know how much exercise you need, what type you need, you've got your goals figured out, you have a plan set in place. How can you stay consistent? One of the biggest things is to make exercise a habit and make it enjoyable. You're more likely to stick with an exercise plan if you like what you're doing. So for example, if you know that you hate the bicycle, don't purchase a bike to use at home and think that you're actually going to use it, because chances are you probably won't. It'll probably sit in the corner collecting dust, kind of a place for you to drop off all your clothes and things, and never end up using it. So find an activity that you enjoy. Some people prefer to exercise with a friend or a family member. I personally like to listen to music. That helps me kind of take my mind off of the exercise. Maybe you like to exercise in a group setting. So whatever it is that you enjoy, try and make that part of your exercise and be consistent. Okay, you can't develop a habit if you're only, every other, day or on a whim, doing your exercise. Try and make it, a schedule. Which brings us to our next point, schedule your workout. So try and plan your exercise in advance by scheduling your workout around your optimal time and environment. So if you know that first thing in the morning, you don't breathe very well because you've not had your medications, maybe you cough a lot in the morning, try not to exercise first thing in the morning. Wait later in the day when you've got a little more energy, your lungs are a little more clear, you've had time for your medications to work. Schedule your exercise around that. Again, kind of going back to safety, avoid extreme weather. So pay attention to the weather, especially if you are exercising outside. Look ahead a couple of days, and if you know that it's supposed to rain on Friday, when that's normally your day to walk outside, you maybe need to kind of change your schedule around so that you don't miss that exercise session. And then record your activity. A lot of people find it helpful if they actually write down their exercise. It helps them keep on track, and it helps you see your progress. So I'm going to skip ahead a little bit and show you this last page. This is a log that you may or may not decide you want to use. But as you can see, it's got an area for you to write the date, your resting oxygen levels and heart rate. How short of breath are you before you start? Again, you don't want to exercise on a day when you're not breathing very well. So make sure that your breathing is closer to a 0 versus versus being really short of breath before you even begin. Now the rest of it, where it says cardio, your leg strength or your balance, dumbbells, resistance bands, that's your upper body exercise. Whatever helps you keep track of it, you can use to record. So maybe you just do a simple check mark. Maybe you put a sticker on it to show that you did it that day. Maybe you're more detail oriented and you want to write down how many minutes you actually rode the bicycle for, or how much weight you lifted, how many repetitions. So whatever it is, that helps you keep track of it, use this form to write it down. That way you can see over time how you've progressed. Maybe you see, okay, when I first started this, I could only walk for 6 minutes around my house. But now that I've been exercising 3 days a week, I'm up to 15 minutes. It really helps to see your progress in writing to keep you motivated. And then last thing, there are occasions when you should not exercise. So if you have a fever or an active infection, if you feel nauseated, if you're having chest pain, if you are out of oxygen, or if your oxygen levels drop below 90, these would be reasons to skip exercise for that day. You may even consider calling your doctor. So these could be, signs that you're coming down with an infection or that you're getting sick. So I hope that you've enjoyed learning about the benefits of exercise, how much you should aim for each week, and then, why it's so important for you to maintain a consistent exercise routine. So I hope that you feel motivated and safe to begin exercising at home. But if you have any questions at all, please feel free to ask your coordinator. We'll be glad to talk with you more specifically in person. So enjoy your exercise.